just let them answer questions, but I do want to give them a moment to say a word if they'd like to. Georgia Winston is chief of the autism program in Illinois. Georgia.
Thank you, Senator. I am just really excited about this legislation. One of the things that we heard several years ago when we talked to parents, one parent told me that if I were driving on the interstate and I was about ready to run out of gas, there'd be a great big sign that would tell me I can get gas here, and so I could be reassured that my journey would be completed. That parent told me that they wanted to see a similar thing for autism services. The Autism Care Centers that you plan through this legislation, Senator Durbin, will make that a reality for families across the country. This really is a watershed moment for individuals with autism. I believe that the services that are outlined in this legislation, the insurance appropriation outlined, or the insurance mandate outlined in the legislation will make a tremendous difference. I thank you, Senator Durbin, for your leadership.
Thanks, George. Appreciate that. And let me say a word. Hope School is a special place in my heart because it is one of my former clients. When I was a private attorney here in town, I was happy to represent them and came to understand why it exists. It existed at the time because there was no other place for a local dentist to send his blind, mentally ill daughter. And so he created Hope School. And over the years, it has evolved to serve so many young people and adults who face extraordinary challenges. Dr. Joe Nair has become a recognized expert and leader in this whole field. I'm glad that he is here today representing Hope School and efforts to improve the treatment and diagnosis of autism. Joe?
Thank you, Senator. Thank you. I'd like to thank Senator Durbin, the co-sponsors, and all the people across the country that came together to really work towards consensus to achieve this bill. As a clinical psychologist, as a health service researcher, and as a health service administrator, I know that this is going to make a significant difference in the lives of children and adults with autism and their families. So once again, I very much appreciate and thank Senator Durbin and the co-sponsors for their great work and look forward to the bill's passage. Thank you very
much. Senator, you said the legislation that was passed in Illinois isn't as comprehensive as you'd like. How does this bill differ from that and improve upon it?
Well, Jim, we're going to find out, because I was a little bit surprised earlier when I asked parents here about insurance coverage, because I thought we'd taken care of the issue in Illinois. But it turns out in areas of self-insurance, for example, there is a serious question as to whether the Illinois law goes far enough. So let's take a look and see what gaps there are in the 8 states that have mandated health insurance coverage. And I'm going to try to fill those gaps with this federal law. I think each state is going to be a little different. And I just learned today that there are some things I need to address.
Are there limits in the amount, the dollar amount yearly?
And the type of services covered. I mentioned earlier the training of parents and family members to deal with children with autism. Usually health insurance goes directly to the patient served. In this case, the patient is being served by the family 24/7. And so the family training is as effective or as important as any other medical services. So it could be that we need to extend the insurance coverage to deal with this treatment aspect as well.
Senator, what's the status of the bill? I mean, was
just introduced. And what we're going to try to do is to ask our friends in the autism support groups around the nation to encourage their senators to join me as co-sponsors. If we can build up a good backing of co-sponsors, I think we have a good chance to pass it.
The big argument here will obviously be that you're now dabbling too much in the private sector when the marketplace could sort this out. There are insurance companies that provide this sort of coverage, so is it undue interference on the part of the government to do this?
Of course, that's the argument that we'll hear from some in the insurance industry, and it's exactly the same argument we heard when it came to mental illness. And I just honestly believe that we have to be very frank and honest with the people of this country that when it comes to health insurance coverage, health includes not just physical illness, not just emotional and mental illness, but clearly autism, which, as Dr. Nair has told me, somehow has been defined out of both. It should be covered. You're dealing with young people and adults with profound challenges, and they deserve the right care so that they can have as complete a life as possible.
At the risk of being politically incorrect, 10 years ago you wouldn't have known about autism unless you had an autistic child.
That's right.
Why now? What's happened that suddenly it seems like we're constantly hearing about autism? Not bad, But I'm wondering why.
I really think others can answer that better than I can. But I will tell you that I am certainly much more aware of it and stunned by the numbers. When you're dealing with 1 out of every 150 children, that means 1 child for every 5 classrooms in every school in America. That is a significant number when you consider the profound challenges which an autistic child can bring. Georgia, can you say a word on that?
What we know about autism is that we have a tremendous number of adults with autism over generations that were erroneously diagnosed and did not receive treatment. We also know that we have gotten better at diagnosing children with autism and that we have expanded the diagnostic categories for autism. Now, there's a small amount of the variance in the increase that is not accounted for at this point. But we do know we've gotten better at diagnosing children and that we are looking at autism differently than we did in the past. I think the really compelling story related to autism is the fact that generations of individuals with autism were not recognized and did not receive treatment. I came to this position from working with many adults with autism. And I had the task of going back and doing developmental histories with parents who were sometimes in their 60s and 70s. And what emerged was a child with autism that didn't get appropriate treatment. The fact that we're diagnosing kids means that their life course is going to be tremendously better than the generations of people with autism before them. So that's one thing that we need to think about. People with autism in generations to come are going to be out there working, they're going to be enjoying life, they're going to be reaching their potential, where in the past they were languishing in very restrictive care settings and really weren't able to reach their potential.
Sherry had mentioned that if this goes through, there will be no secrets now for families to deal with this. How prevalent is it that this is still a secret? Are doctors not diagnosing it, misdiagnosing it, not running the tests? If they discover it, are they not directing families to the proper services? Where is the system breaking down beyond just the lack of coverage?
I want to ask Dr. Nyer to comment on this as well, because I know he's had this similar experience. When the autism program began in fiscal year 2003, I met with a group of about 11 developmental pediatricians here in Illinois to talk about the needs of children with autism. And I had more than one physician tell me that they were reluctant to diagnose children because once they provided the diagnosis, there was nowhere to go for treatment. So I know that physicians were really afraid to diagnose children because they didn't have a hopeful message to give to parents. That's changing through this legislation. I think physicians are going to be more willing to diagnose children. Also, we're educating physicians. We have an arrangement with Illinois Chapter of the American Academy of Pediatrics. We're educating physicians about the importance of early diagnosis, and that's changing.
One thing I'd like to highlight, like no other condition that I've known in the last 20 years, have parents played such a pivotal role in raising awareness and helping others understand what needs to be done, what needs to change to make a significant difference in the life of a child and an adult with autism. So parents should be recognized as a group that's come together and increased awareness, and not only of the needs, but also of the disorder and how we can change social policy to support some of our most vulnerable citizens. We know if we treat children early, that the outcomes are much greater later in life, which suggests the cost-benefit analysis from a fiscal perspective or social policy perspective is quite clear. The sooner we intervene and the more legislation we have, like the legislation introduced by Senator Durbin, we know that we're going to have much greater outcomes for children as they turn into adults, into the age of an adult, and live much more productive and happier lives. So once again, we'd like to thank Senator Durbin.